This is a research project done by Elizabeth, Christina, Mariella, Darlene, and Jacob. First, to start, we have articulated the importance of our research aim and how we intend to accomplish this aim. It is crucial to understand the opioid epidemic that has impacted the lives of many Americans. According to the CDC, an opioid is any drug considered a controlled substance that helps relieve physical and internal pain. That can include prescription opioids, fentanyl, and heroin. Due to the nature of this drug, it is considered high for addiction. In 2017, the U.S. Department of Health and Human Services declared a public emergency. According to the CDC, more than 1 million people have died since 1999 from a drug overdose, that being 75% of drug overdose deaths in 2021 involved in opioid. For many health concerns, public health officials have sought out ways to reverse the effects of opioid overdoses. One way is through Naloxone, also known as Narcan. It is an opioid antagonist and life-saving medication that can reverse an opioid-induced overdose during an emergency by blocking the activation of opioid receptors. It has saved more than 26,000 lives. The increase in naloxone availability in the United States will lead to the reduction of opioid-related mortality rates. The importance of research in this area is crucial, and our team has investigated naloxone laws and opioid overdose rates in a comparative study. To put into perspective the gravity of the situation on the overdose death rate in the opioid epidemic, the overdose death rate was a little over 70,000 deaths prior to the pandemic in 2019. And around the fall of 2021, it topped over 100,000 for the first time in U.S. history. The final count for that year was around over 107,000 overdose-related deaths. This is an over 30% increase in about 2 years. And the toll continues to increase every day. A way to help combat this problem is to ensure that everyone, especially people who use drugs known as PWUDs, have an equitable access to naloxone. Now, what is naloxone? It is a life-saving drug that is an opioid antagonist that works by binding to the opioid receptors, clearing and preventing opioids from binding to them. In short, it can stop and reverse an overdose. It would be great if it was available to all with minimal restrictions. However, when it comes to the accessibility and distribution, that is an issue primarily left to each state, statute, and law, with some states having more progressive laws on the access and distribution, while others have more of a restrictive issue on who can have access to it, or a person having to meet certain criteria for it to be distributed. Some states even require certain criteria that has to be met before a prescription. To conduct a study on every state in the Union is beyond the scope of our current capabilities, as such a study will take too long and be too expensive. Rather, we narrowed down our search to the 4 states with the highest overdose death rates, so that way we can generalize our results of those 4 states to the nation. During our research, we found that these states were West Virginia, Tennessee, Louisiana, and Kentucky, with death rates exceeding all other states. As such, we developed our research question to be among the 4 states with the highest overdose rates. Did opioid users have equitable access to naloxone? Our study aims here was to determine if these state laws and mandates have a positive or negative effect on accessibility and distribution. The availability may have a positive or negative effect on preventable overdose deaths. The study design we chose to explore this aim and answer this research question was a cross-sectional study design, as we wanted to select participants based on shared characteristics and not the exposure nor the outcome. The study's characteristic provides a look into overdose rates. Their exposure in this study design will be the participants' exposure to their resident state's different naloxone access laws. The outcome of this study being the previously mentioned study aim. Our target population were those residents of those four previously mentioned states who have a history of opioid use and were over the age of 18. This way, they are consenting adults of the study. They can speak from their experience and struggles from both an opioid use and being a resident of a state with some of the highest overdose death rates. In addition, they can answer questions relating to their experiences in their state laws and mandates towards the accessibility and distribution. The recruiting method for participants for this study was a simple random sampling strategy. This method was chosen as it can be generalized to larger populations and can help reduce the threat of bias within the study, as all participants have an equal access of being selected. The selection of study participants, as previously mentioned, was based on their shared characteristics. The shared characteristics that they were selected on were their history of opioid use and being a resident of the state in which the study is being conducted. Methods used to collect the data for this study include both quantitative and qualitative methods. For quantitative methods, we decided the best course of action to be a survey with multiple choice closed-coded questions. The questions in this survey will relate to opioid use, their state laws, and other related experiences and factors. This way, we can quantify our results and put a number to it. For qualitative data, we decided that given the nature of the topic, the best option would be an in-depth semi-structured interviews with a predetermined list of open-ended questions. The strategy to obtain this qualitative data was one of grounded theory, as we can gather and analyze data from the state's residents and use them to understand a theory about the relationship between naloxone access and distribution laws and overdose death rates. In addition, there are benefits to this method of qualitative data collection, such as how it allows for clarification, since participants can explain their situation and clarify their stances about why they feel a certain way, as well as their views towards the laws. We can also gather data through open-ended questions and pursue follow-up questions based on responses to gather more information and supplementary data. Such an interview allows a more personalized and individualized approach, as most PWUDs, also known as people who use drugs, feel stigmatized and alone in their situation and appreciate a situation where they can just talk to someone who will listen. This method may also be easier to reach those who may otherwise be difficult to reach, since a good amount of PWDs are homeless and as such may not have a permanent address or access to reliable online methods of data collection or communication. A final benefit of this method for collecting qualitative data is that it has a high response rate, as participants will be more forthcoming to answer questions when engaged in a personal conversation rather in an online survey method. Data analysis for quantitative and qualitative research is an important part of the research method we have adopted in our study. The characteristic of qualitative research we did is looking at collection of insights from opioid users affected in these four states and the residents of the state in which this study is being conducted. Part of the data helps in identifying recurring themes and patterns to enhance the understanding of naloxone accessibility and its implications for overdose prevention strategies. The description of the analysis first aims to collect the data. With this, we would have proof of documentation and recording of this necessary data. Then we would need to simplify and reduce the data that is appropriate, selecting valuable and necessary data, which helps to focus on qualitative and quantitative research. This will help on simplifying the data. The next is presenting the data. The best method for presentation is using graphs and charts with clear data display. The last part is to form a conclusion with all the data we have gathered. With finalizing points of data, we give meaning to the data by confirming and verifying that the research is conclusive and with a conclusive analysis.